Here.
Ms. McDonald, Mr. Cicero,
Here.
Mr. Gould,
Here.
Dr. Pitzelis, Dr. Soderquist, Mr. Vega, Ms. Winfrey, Mr. Sabraki.
Here.
We have a quorum.
All right, we'll do the pledge of
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I have no comments. Sue?
Okay, I just have a couple of comments. Wanted to let you know that Dr. Karsavich was not reappointed to our Board of Health. So we were in the process of looking for another Board of Health member. We have found one. The county executive has forwarded the information for Dr. Gary Lipinski to me, and actually Dr. Lipinski and I met last week. We just had a meet and greet to see if Dr. Lipinski could, comply with our meeting requirements and our schedules, and just get to know a little bit about us before, he made a final decision, etc. And it turns out he is very much interested in attending, being a member of our Board of Health and attending our meetings. Dr. Lipinski is the CMO at St. Joe's Presence Hospital. So his appointment to our Board of Health will go to the September County Board meeting, and then it will come to this board at our October for inclusion in our board. The other announcement I had is that we, as of December 31st, we will no longer have Dr. Traeger's services as medical director. So I just wanted to put out there to any of you, if you know of an infectious disease control doc that may be interested in serving our agency on a consultation basis, we would be interested in talking with them. So we're looking for a new medical director.
Yeah. I would reach out to Fred Alexander, Dr. Alexander. He was medical director here for a while.
Right, and actually, I believe that his group are serving in that capacity in the TB clinic.
Okay.
Is Dr. Garganiero?
Dr. Garganiero, yes.
Yeah, I was going to ask him first.
Yeah.
I mean, that's the
pretty
relationship
convenient.
that we had,
Right.
and but we need to make sure we have other options just in case. He may still be getting his feet wet with the TV a bit, but yeah. Okay, and that's all I have.
All right, you've been sent a copy of the minutes for our June meeting. And if you have had an opportunity to look at them, I will entertain a motion to approve them.
So
Move second. Any changes or anything you'd like to see added? All right, all in favor, signify by saying aye.
Aye.
Opposed, motion carries. Okay, treasurer's report and department financial reports. Elizabeth?
Good afternoon. So we have two to go through. So if we could start with the month ending June 30th. We will start with the treasurer's report. The beginning balance was 1.3, a little bit over 1.3 million. There was an interdepartmental correction of $312.50. It was a double charge on the part of the county, so they corrected it and did not make that error. The distribution we did receive in June was a little bit over 4.1 million, which brought our total receipts to slightly over 5 million. Subtotal going to 8.2 million. You take out the expenditures for that month, and that does bring us down to 5.6 million. Are there any questions on that treasurer's report?
Just as a correction, I think you meant for beginning balance 3.1, not 1.3.
Oh, I'm sorry. Did I say that? Okay, I apologize.
That's
That
okay.
came out of my mouth in a dyslexic
It's
form.
getting low enough as it is, so I just want to.
Correct. So we'll move on to the schedule of revenue. The schedule of revenue does show for end of June that our target is 58%. You can see once again our levy distribution is around 51%. If you look at the departments for total fees and reimbursables, We are at 65% for the community health center. We're at 82% for family health services. So the total for all the divisions is right around 61%, which is higher than our 58% target. If we go down through the grants, you will see that we did get a payment under bioterrorism of a little bit over $94,000. So that brings their admin total grant to about 52%. CHC total grant is around 54. Also in environmental, if you see, we did get a payment for the vector grant. We also got some tanning bed money and some body art money. So that brings the EH grant total to 66%. Family health services is at 50 and behavioral health is at 50%. It brings our total agency revenue to 54%. If you compare it to last year, we were at 61% at the end of June. Any questions on the June schedule of revenue? All right. We can move to the June, ending of June expense statement of expenditures. Once again, we try to do a month in the rear, so we're shooting for a 50% goal, and we are at 50.7%. The next one is our capital improvement fund. We had a little bit of interest come in, so our beginning balance was $37,233.38, and it brought us to a balance of $37,236.10. Any questions on that?
I think I'm going to approve them separately, the separate months, so I'll entertain a motion to approve the June Department financial report, treasurer's report.
Second.
Moved and second. Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed, motion carries. Okay, continue.
All right, then we'll move on to the month ending July 31st. Beginning balance is over 5.6 million. We did have a distribution that also came in and our various receipts, bringing our total receipts to over 1.7 million. Subtotal of 7.3 million. Take out the expenses and we are down to approximately 5.3 million on the treasurer's report. Any questions on that? All right, well, let's move to the schedule of revenue ending in July. Our target is 66.4% that we are 66.6%, excuse me, that we're looking for. You'll see that our levy came in and is showing right around 54%, which is right on target for at least, well, we're about halfway through, so it's a little bit low. If you look at all the total fees and reimbursables, I just wanted to point out Community Health Center is at 70%, Family Health Services is at 91%, bringing our agency for total fees and reimbursables to 67%, which is right on target. I just wanted to point out when we plan and we budget in the year ahead, we know what our grants are supposed to be. So grants should be pretty much on, we propose what they are going to be, we get paid. Our fees and reimbursables, we really have to, each division has to study what they've done in the past, what they project, and to be at 67%, which is right on target, is a great idea of how well we projected for this year. If we do look at the grants, once again, we did get a payment, which we're hoping is just a half of a payment, for the federal financial participation of a little bit over $200,000. So we're hoping that we get the rest of that money down the road. That brings our administrative grant percentage to 69%. If you look at Community Health Center, we did get a payment under the 330 grant, a little bit over $500,000, which brings their grant total to 79%. Environmental health, 70% grant total. Family health services around 50, and behavioral health we're also around 50, which brings our agency total revenue to about 60%. Last year it was around 65%. And keep in mind, once again, our target is 66.6%. I did want to point out there was a appropriation that was made. So the 17 projected budget did increase by $85,434. We received we appropriated some money into 2 family health services programs, the teen pregnancy prevention program and the tobacco control prevention grant. So possibly you noticed at the bottom there that there was a change from June to July.
The tobacco grant, any dollars coming in on that?
Yes, I think we actually got a payment that will be shown in
Next month?
August. Yes, it came in August.
Two payments, actually.
Two. Any questions on the schedule of revenue? All right. If we want to move to the statement of expenditures ending in July, once again, our target is 58%, and we are at 57.6%. Right on target. Any questions with that? All right, and then the capital improvement fund, once again, a very small amount of interest of $2.82, which brings our ending balance to $37,238.92.
I'll
Any
entertain a
questions?
motion to approve the July treasurer's report and department financial report. Moved.
Second.
Second. Any further questions? All those in favor signify by saying aye.
Aye.
Opposed, motion carries. All right, Elizabeth, you've got the microphone there. You can start out with your report.
I really don't have any additions. The only thing is, I do want to draw your attention that we do have a resolution for surplusing the Ford Taurus, and that'll be coming later in the agenda. Other than that, I don't have any additions unless you have some questions.
Did everybody see the pictures that Elizabeth put in your report? She's been doing a great job at our Northern Branch office, getting that office up to date with walls, floor, ceiling, and some changes. The signage on the windows. It's been a great experience for staff. We're moving into family health services next, and then environmental health will be after that. So it's working out very well.
I had an opportunity, John and I attended the open house, and we're quite impressed with the changes and how much better it looks. You know, when you're in there for a long time, you kind of get used to what it looked like, and well, a little bit shabby there, but fortunately the landlord is willing to incur some expenses to make it look a little better. And
We just got to keep them moving.
well, and you're the one to do that,
Yeah.
obviously. He's moving.
We figure out our water leak down here?
We're still working on that issue, so.
And that leaked the first rain we had when we built this addition.
Oh, jeez. Really?
Yes.
Oh, that wasn't a good sign.
No, it wasn't. Still.
Pat's looking at it and coming up, process of elimination, obviously with, we're in the process of, the new building, so we don't want to spend thousands of dollars out there to do big excavation and whatnot. So we're going to try and do process of elimination and do it on the cheap if we can.
Winter's coming, hopefully rain won't be an issue.
We'll come in while the ice skating rink in here, no.
What we had. All right, Joe.
Okay. Sure. I was just going to highlight, I'm adding one feature to my monthly report, and to give you an idea of the number of patients that we see for free. That is, they have no reimbursement, they have no money, and I did a comparison between last year and this year, and the number of services. When you look at something like 406 services, we're talking about services averaging 15 minutes to an hour. And last year, we served 141 patients with no resources, and this year so far, we've served 75. The other thing I'd like to share with you is kind of a mid-month report on revenue. As of this morning, and these are deposits, checks in hand, the division has $144,681.60, and that's so far for the month of August. As you can see in my other report, what previous months looked like, including $239,000, a high for the month of June. And the last item, I'm going to pass it around. This is something that was in the news yesterday, a major feature article on lack of resources for mental health in Will and Grundy counties raised concerns. This came out yesterday, just got it a couple of hours ago. And I want to put something in perspective in terms of a shortage of mental health services in Will County. According to the county's need assessment, Will County has one mental health provider for every 1,063 people. Let me give you a contrast. Illinois, which is no shining example, has one provider for every 560 people, and in the United States, one provider for 370 people. So from an average of one per 370, you look at Will County, we're one per 1,063. And that gives you kind of a reality perspective as to why there's such a shortage of mental health services. I'm just going to simply pass this around. And I was one of the people interviewed, and the discussion in there was treatment of last resort. Where do people go where they have no insurance? They're not able to get Medicaid services from private practitioners. And the bottom line is always, the place of last resort is the Will County Health Department. Thank you. Any questions?
Question on the people who have no means of paying. Are we exploring whether they're eligible for any kinds of insurance or Medicaid?
Oh, absolutely, absolutely. 2 of my reimbursement specialists are certified navigators. And that's something we did very early, that when the money came out, we actually took 2 of our reimbursement specialists, so they're navigators and they're able to get them on services. Also, we've got I just signed an updated copy because we have CARF coming up in 2 weeks. Well, we've got a 3-page policy and procedure for collection and soliciting of information from the individual in order to determine that in fact they're homeless. Part of that is the consumer, the patient is so decompensated that, you know, they're living out of a paper bag, they're living out of a shelter. DAYS program, certainly the PATH program, deals with a lot of these individuals that are nomadic, for a lack of a better term. They live under the bridges, they live in the forest preserves, they're in and out of the shelters. So with the PATH grant, we wind up taking care of a number of these individuals. But we really exhaust qualifying them for services.
Well, you would think that somebody in that kind of a category would qualify for something.
Yeah.
I mean, I know they don't have any money to pay, but
Yeah.
some of that is subsidized, and certainly Medicaid, when it was expanded,
Yeah.
I think it would cover it.
And a lion's share of our patients were able to go to Medicaid expansion, which is a good thing, especially since the state of Illinois pulled all their grants. But these individuals don't have the minimum paperwork at times, identification at times, to go ahead and get them qualified.
So they may be qualified, but they don't have the skill or
And the
resources
papers.
to
And the
do the
papers.
paperwork.
Yeah.
And
Yeah.
are you finding that too, Mary?
Among the behavioral health patients?
Just patients in general.
The majority who don't qualify are undocumented.
Undocumented.
Oh, yeah, that's true for us too, yeah, I'm sorry,
Yeah.
we should have mentioned that.
That's usually the case.
That's, okay.
Yeah.
Yeah.
Okay. All right, thanks, Joe.
Hello. The only thing that I want to add to our report is that yesterday we were surprised to see the Basingers pharmacist at our facility. And so she came with their technician. They still don't have any stock on the shelves, but they're working to get back into operation, and they said by next week they plan to get started. So.
And the delay was due to the state not providing someone to do an inspection, is that what I understand, or is that not?
No, the inspection was done within the first month. They had told us the delay was waiting for a state Medicaid number, pharmacist provider number, but
Did you have it now?
evidently, but they told us they're all set to go.
Mary, I have one question on your report here, under July.
Yes,
You show the unduplicated January through June
yes,
for the 2 years, and then you've got target from HRSA 14.8. That's an annual
for
target.
annual,
That's the
exactly.
annual, okay, so that's not where we should be at June
Exactly.
26th.
Exactly.
Okay, that's
Yeah.
kind of what I thought.
it's still a large number. We're not likely to hit it, but we don't know. We've been very busy in Bolingbrook. And come September 1st, Dr. Navakis will be seeing patients 3 days a week in Bolingbrook. And his schedule is already full. We're hopeful.
Anything else? No? Any questions? All right, Dr. Bird.
I don't have any additions unless anyone has questions for me.
Tom?
Okay, good afternoon. Couple things I wanted to add to my report. As of August 10th, we have now run 131 mosquito batches for West Nile and have 17 positives. Of our 12 traps, the only ones that do not have a positive is one in Plainfield and one in Bolingbrook. We still just have the one human case of the gentleman in Crete. Also on August 10th, IDPH released an update that West Nile has now been found in 41 of the 102 counties in Illinois. And of the 4 birds that we've collected so far, and 5 is our minimum for the surveillance year, 2 robins, a hawk, they both tested negative so far. We have a chickadee that we are waiting on the results for. Regarding the permit to discharge program, since our numbers have been sent over to collections, we have, in addition to my report, I mentioned 8395 was brought in. Since then, another 5,126 has been brought in. So of the 524, just shy of 525,000, there is 40,791 still outstanding. And Crete Elementary School District is back in the news. We got notice from them that they had tested positive for elevated levels of lead in their drinking water. IDPH has been contacted. They released their mitigation plan to them of what they want them to follow. The schools are Crete Moni, Talala, Crete Early Learning, and Balmoral. On August 14th, the parents and guardians were notified, and IDPH's mitigation plans for them is either to eliminate with treatment and then retest, or remove the fixtures altogether that were found to be contaminated. And the last thing I wanted to say is I wanted to commend Katie Nelson, who made the Herald News on August 8th. She'd probably shoot me if she knew I was showing this picture, because she's not happy with the picture, but she's run an excellent program. It's so very well organized, and her efforts are very appreciated, and I just wanted to give her some kudos, because without her, it would be a tougher game. So.
I have a question about Crete water supply. Are those private wells that are serving those schools? Or
Yes.
Are they...
Well, I would have to check on all of them, Jim, but the Balmoral, I know for sure. Crete Moni, I'm pretty sure it is. The Early Learning in Talala, I would have to check if it's on a well or not.
When they sample the raw water and then sample it from like a drinking fountain?
They're supposed to sample, just like if you remember the incident at Balmoral back in December. They had a raw sample tap that was just before the pressure tanks that we would collect from, and those always came back clean. And the ones that were throughout the school, you're dealing with old pipes, old plumbing, old solder, and that's, I'm pretty sure in the distribution system, that's where we're getting our trouble.
I see a lot of, several schools are starting to report the results of their testing, and it's very similar that certain areas within the school, they're finding the problem, so they'll have to.
Right.
So Balmoral was elevated, and then they came into compliance, and now they're...
No, they're working on their mitigation plan right now.
Okay.
So IDPH gave them their guidelines of what they would like them to follow, the rules, get a team together, understand the mapping of your plumbing, flush water lines out in the morning, and then try to narrow it down to what the problem is, and either eliminate the fixture or get treatment.
Okay, thanks, Tom.
Okay, you're welcome.
Pat?
Hey, hi, everybody. I really don't have anything to add, but I do have a teen resource guide that we talked about in teen pregnancy prevention program right up here, hot off the press. So health educators put a lot of work into this, and we think it turned out very nice. So we wanted everybody to get a copy of it.
Pat, I just
Yes.
have one question regarding the lead program.
Lead program.
That big
yes.
change?
Big change. We used to get, what was $7 a test back, as we would do the lead screenings in the WIC program. And we would get $7 a test back from the state. They ran out of funds, no longer doing that. So as of July 1st, we can't provide lead screening for free. We have no system of reimbursement. Plus, it was just an additional screening in WIC. You know, they were doing finger sticks for hemoglobin anyway, so it was pretty simple to do the,
Your rates for elevated leads were real low?
yeah, they're not wrong. We don't have, well, if you look at our numbers.
Because you have to think that the way they're you're referring out now to doctors, that's the likelihood that there'll be follow-up there. And
Well, there will, here's what happens with that grant, though. We're encouraging the doctors to do what they're supposed to be doing as far as doing the lead screenings at the appropriate ages. Okay? No matter where in Will County that test is done, we're gonna get the results of it. So then we have to still follow up with that. If it's elevated, we still have the case management part of the grant. So we will be following up to make sure that things are done, you know, that they get their educational home visit, and in conjunction with the state to do the actual site visit. We still are going out and doing things. It's just that we no longer have a means of doing as many screenings as we were doing in WIC. But we're hoping to just switch the emphasis onto health education out to the physicians in order so that we won't
Make sure
totally
it's
get
getting
right.
done.
We want to make sure that the kids are getting it done. Yeah. Okay.
All right. Katie?
I just wanted to comment, I haven't seen this, this is literally hot off the press. This is extreme, this is impressive. This is, to think that our staff put this together is so impressive. I mean, they do a wonderful job, they are great at their computer systems. This looks so professional, very polished, very
Another
nice.
Cindy Jackson program.
Very nice. Thank you. Thanks a lot, Cindy.
I just said that.
All right, Katie.
I have nothing extra to add unless you guys have questions about any of our activities. It's been a little bit slower July and August, just going out and trainings and getting the new grant year started back up, so.
I see we're close to 100% on staff being trained.
Yes, and we might have hit, with people that are outside of the probation period, might be at 100% now. Whenever we get new people in, we give them 6 months to get those trainings done. I know out of the 5 people that started July 31st, 2 of them came in with all the trainings already completed, so that helped a little bit. So we're not disappointed with our numbers because the new people just, you know, bring us down temporarily because they have a grace period. We're still working on command staff, and then we also are implementing a new command training with all of our command staff this year. Short trainings, some months where they can sit at their computers and do a short quiz for us based off of a PowerPoint, and then we also have a consultant coming in and helping us kind of get our command up to speed with some of the FEMA forms, and we'll conclude with the tabletop in April.
Thank you. Steve?
All right, just a couple things to add to my report. Yesterday I was on the phone quite a bit with Megan Schuler, who did the article in the Herald News that Dr. Triani had just talked about. In fact, she asked for an additional picture. I gave her the one from our event in Beecher, which was about, of course, addiction recovery and suicide prevention of County Executive Walsh, Dr. Triani, Dr. Dubois, and Dr. Kathleen Burke. And then I made sure that she also knew, and Dr. Dubois, thank you for your help with that, our next event of that regard is August 31st, 6:30 p.m. at the Homer Public Library. So we're hoping to hit that event just as hard as we did the Beecher one. Also, I did call my old friends at WJOL. I will be on the air at about 4:20 tomorrow in the studio, giving them a preview of the open house at CHC at 10 o'clock on Fridays. So we'll be talking about that. And Mary and I did talk earlier today about Basinger Pharmacy being able to show up. I'll be down there next week. We want to get an article out on that. So those are all my additions.
All right, thank you.
If I could just add to Steve's report, if anyone hasn't visited our website lately, if you might want to do that, Steve's done a lot of cleanup on our website. He's worked with other staff to do a lot of cleanup, much more current articles. We're adding YouTube videos that are pertinent to stories that we're doing, and YouTube videos on just public health in general. We've made some enhancements. We've made some enhancements to the Facebook page. So, working along those lines.
Thank you. All right, moving on to old business, strategic planning update. Sue?
Okay, we are still moving right along. As I mentioned in my report, we are in the process of doing our visioning exercises. I think we're just about finished. Admin did ours day before yesterday, and we finished ours then. And so we'll have the complete visioning exercises done at the end of the month. Beverly will put those together, and then we will vote on those as an agency. Right now, staff have access to a SurveyMonkey survey on core values and the value statements that we attach to them, and they are voting on one of 3 value statements for each core value, and how they think that that core value properly addresses the agency and our mission. Once that is done, then an engagement survey will go out to all staff. One of the things that we don't do on a regular basis is, agency-wide anyway, is put out any kind of a survey for staff on how they feel about the agency, our goals, do they work well with their immediate supervisor? Do they feel like their work is appreciated? Just all sorts of questions about their engagement with our agency. And it's important to do that because, that's your workforce. Those are the people that are working with the community. And obviously we want the workforce to be engaged and happy. And so as part of our strategic planning process, we need that feedback. So that engagement survey will go out after the survey that's currently out is over with at the end of the month. We also have set the dates for the strategic planning retreat. That was in your packet. It's going to be Wednesday and Thursday, October 25th and 26th, all day long, 8:30 to 4:30. We are looking at either the JJC building downtown Joliet or the JJC main campus. I'm working with one of the individuals from JJC, and we're going to decide what's best for our situation. But we've got those dates. So I wanted to put those out to the board right away, so that you would be able to put that on your calendar and be able to participate. And that's it for the strategic plan.
Sue?
Yes.
May I ask a question?
Absolutely.
There were a couple things that in your report mentioned the community health center. One has to do with cutting back on family planning services, and the other about explore privatizing the community health center.
Right, we're going to get that to that in just a second.
Oh, okay.
Yeah, I'm going to kind of go.
Oh, I'm sorry.
I'm going to cover the budget piece.
Oh,
next.
the budget, that's right.
Yeah, because that's going to take a little bit longer time. The new building update I wanted to cover next. Right now, as mentioned in my report, we are doing the programming part of the process. That's going along really, really well. The meetings are long. They're about 3 to 3.5 hours, but they go by really fast. We're talking about what we do and how best to do it, and what kind of space do we need to do it in, and how are we doing it now as opposed to how can we change to do it to be more efficient, etc. So it's really a great experience. We're going to be finishing the programming piece this month, okay, at the end of August. And then the Kluber Associates, who's the architectural and engineering firm, they're going to be putting all that information together and looking at what our space needs are and adjacencies to different departments, etc. And then in October and November, they're going to do the site selection. If you recall, the county has contracted with Kluber to do a site selection, look at 3 different sites for our building. This is the first site, this campus. The second site is the old courthouse, and the third site is, we don't know. I asked Kluber point blank yesterday if they knew and if they could tell us, and they didn't tell us, so I don't know if they know. He said that they didn't know yet. That's to be determined. So I don't have any information there, but the site selection will take place October, November, and then, once they have that figured out, then they can determine what kind of building, whether, single story, two-story, looking at the site and then looking at our programming as far as how much space we need with our programs. Then they'll be able to determine in just general terms, the size of the building, X number of square feet, 1 or 2 story. That's all we'll get. We're not going to be going any further in design after that. And then, I guess, I would assume the county board would make a decision on the site, and only then will they be able to move forward on the actual design. Yesterday, we toured, myself and Elizabeth Galata, Pat Thorne, we toured the public safety building, the new Sheriff's Department, ETSB, and 911 Dispatch Center on Laraway Road. It is really nice, very nice. Of course, it's all brand new, and a lot of thought went into the design. The surfaces, the way it's designed, security, all that. It's really great. So I know Denise, you were there. What did you think of it?
That was my second time being in, and it is really nice. And I was talking with Elizabeth earlier, the thing to remember is during the programming phase now, is for people to say everything that's in their mind about what they might need, what they might want, what they think needs to happen. Because that's how we got to a space that's going to work so well for the people who are going in there.
Yes, thank you.
And that's a big piece.
And I think, the wish lists have come forward. Everything from, a workout room to a coffee shop. I mean, and we just forwarded all to Kluber, and, they'll make sense of it. But that was a good experience yesterday, and this whole programming session with Kluber has been gone very well because they know public health. When we talk about WIC and what does WIC need, they know what WIC does, and many of the other divisions. So it's been a good experience.
Kind of scares me thinking about the courthouse as how in the world do you renovate the courthouse to?
Well,
it's all concrete, poured concrete walls. And you got stud walls are easy to take out before you start going in trying to renovate.
Nothing friendly about that.
Well, from what I understand, I don't recall what the exact number is, maybe Don or Denise does, but it was tens of millions of dollars to renovate that building. And I don't know, personally, I think it's a very ugly, cold building. It wouldn't suit our needs as far as parking.
No place to park.
But, it's one of the sites we're looking at, and I don't know the whole picture.
Right, and I can understand the county, it's a resource that they
Exactly.
have, and they should
Absolutely.
look at what it could be used for. I'm just not sure that it fits to multiple floors, small.
Right.
You could be sitting in the judge's chamber there.
Yeah, no thanks. So,
And the jury
jury
box is where the people would wait to get served.
yeah, there you go.
Wow.
Hopefully they'll renovate it a little bit more than that. But, so we'll keep you posted, but the process is going along as planned, on schedule, and very well. Thank you. The annual management address, I just wanted to make sure you saw that piece. It went very well. Every year I will be doing a management address in July and an all-staff State of the Agency address in January. So those are two things that I will continue to do. It was the management staff was very receptive. A lot of positive statements. New building was one of the things that was mentioned as kind of a shot in the arm for staff, and a real good energizer, and so it went really well. So we've got an unbelievable management team here, really do. Okay, the last item that we were going to talk about is the budget status. To Marie's questions here, if I could just back up a little bit though. We talked about the budget status at our last meeting in June. And at that time, it was mentioned that we are looking at a gap. I think the gap we mentioned at that time was a little under $700,000. And I know you're looking at my report now and you're seeing, a gap of $964,000. The reason why there's a difference there is because we pulled out $250,000 that we initially put in from our cash reserves, okay? The reason why we did that is because when I went to the county board this past year and requested if we could get an interfund loan, or at least set it up in case we needed it, which by the way, we haven't, and we haven't tapped that. There were several comments about the fact that we need to increase our cash balance, and over time, if we increase our cash balance, well then, maybe we would not have the need to do the interfund loan. So what we did is we decided to take that $250,000 out from cash on hand and look at what the real gap is. The real gap is $964,000. So what I provided for you is some basic overviews regarding the budget and some historical things. As far as the budget for this coming fiscal year as proposed for fiscal 2018, in administrative services, we've got a slightly increased revenue. Emergency preparedness, as you know, is what we call budget neutral. We get a certain dollar amount in grants from the federal government to do that program. That's all we spend. There's no levy dollars whatsoever that go into that program. Environmental health has slightly increased revenue, and actually environmental health is also working on looking at raising some food fees and looking at other fees within the department. So there may be some increased revenue there in addition to what they already have, which might offset some of this gap also. Behavioral health is approximately $1 million lower in revenue. I provide some historic kind of benchmarks there. We already closed forensics and addictions, and yes, EDA. We're doing very limited capitated care. Psychiatric leadership for adult is gone. Juvenile justice eliminated last year. And just wanted to make you aware of some of the information about the programs itself. In other words, adult services and child and adolescent probably use about 1.2 to 1.5 in levy support. If you look at the community health center, they've got a slightly increased revenue, but they of course also have increased expenses. All the community health center programs are Category 3, which means that they do rely on the levy, and they do provide services to a large number of people. As an FQHC, we have to provide all primary services. We can't pick out or eliminate OB and keep family practice, or pick apart that way. We have to keep all primary services. We don't have to provide dental. It's in our scope. We can change our scope. We don't have to provide dental. We don't have to have the dental van and the medical van. Possibly cutting back family planning. Marie, that's what you were stating. Possibly cutting back family planning to the level of the grant so that we don't spend levy money on that. Family health services, some facts and figures about family health services. Except for the AOK staff, all Category 4 programs were eliminated in 16 and 17. We increased fees last year in vision and hearing, immunizations, travel clinic. We got rid of case management last year. All we do is high-risk case management. I think we eliminated about 25 staff. Is that right, Pat?
Yes.
In your division last year?
Just last year.
Correct. Right. We have a couple of new programs, C-DASH and TPP. Right now, teen pregnancy prevention funding is kind of on the bubble if you've been keeping up with federal agenda, and C-DASH is going to continue till 2021. No?
No, that one
Is that the one in 2018?
That's the one in 2018.
Okay, I apologize.
That's the one in
2018.
The teen pregnancy is kind of at risk too? Or no?
Yes.
Was that a 5-year?
It's in the proposed budget.
We're supposed to go to 2020.
It's in the proposed federal or state?
Federal. They want to cut at the end of this year. So, like, 3 years, 2.5, 3 years early.
There's a lot of pushback on that.
Yeah, there is.
There's a lot of legislators.
So I guess we're kind of at a point here, and I've provided some options. Hopefully you've read through those. You know, we're at a point where we have no other public health programs to cut. Over the last 5 to 6 years, we've cut almost 100 staff. We've cut programs in family health services very heavily. We've cut programs in behavioral health. And we have no other public health programs to cut. We are pretty much bare minimum. The reason why I'm putting some options out there for the community health center and some information about behavioral health is because, quite honestly, I think that we're getting to the point where we have to look at if we can continue to provide patient care services. And when I say patient care services, I'm talking about behavioral health and medical. Now, I think what both of those divisions do is wonderful. I think they serve a purpose. I think that they provide great services. This is a fiscal issue. There simply is not enough money in the budget to continue to pay for both of these kinds of services. I have met with the county executive. I've met with representatives of the Republican side, the Democratic side. I've met with anybody who will listen to me about advocating for this agency, the whole agency. And there's only so much money to go around. I have requested an increase in our levy. As you know, at the June meeting, the board, you put forth the resolution to increase the levy. That has been presented to the appropriate county officials. I also presented a suggestion to all of these people I've met with, as well as the budget director at the county, if the county could look at taking over some of our infrastructure expenses, like snow plowing and landscaping services, and not landscaping, mostly it's grass cutting. Infrastructure costs that, security and things like that we pay for, that many of the other county departments don't pay for. So if we could get some assistance there, that would be helpful. I've also requested maybe the county executive put forth a request to have the county provide us with that $250,000 interfund loan, or I'm sorry, interfund transfer again. That would be helpful. It's not going to close the gap, but certainly it would be helpful. So we are at a point where I don't know that a decision obviously can't be made today, but it's a decision that has to be made. And there's got to be a discussion as to what the future of this agency is going to look like. If we choose to eliminate one division or another division or parts of services in either one of those divisions, we don't want to do it in a knee-jerk reaction. We don't want to do it haphazardly. We want to do it responsibly. We want to do it with planning. We want to do it with our patients in mind. And if I were to come to you one day and just say, gee, we need to come up with $1 million, which is pretty much what I'm saying today, and you have no time and you have no options, there's nowhere else to cut but those two divisions. So we have to have that discussion to start a process.
How long has the levy been at the current amount?
Well, it has fluctuated less than 2% over the last 6 years. It's been at 9.64 for the last 2 years, and it was less than that on, I think, year 3 prior to that. I have the document in here if I could find it. I don't know if I brought it with me. But it's been relatively flat over the last 7-8 years.
And we have balanced our budget by eliminating positions and programs.
Exactly. That has been how we've been balancing the budget. Every year we have increased costs of doing business. whether it's, contractors that we deal with. I mean, as you know, in your own home, every year it's more expensive to heat, it's more expensive to, to maintain, et cetera. So we have those increased costs, and then we have our obligation to the bargaining unit and our contractual obligation to provide them with increases. That happens every year no matter what. And we aren't provided any funding to do that, so we have to find it within our budget to do that.
Your infrastructure costs that you mentioned are almost $700,000.
The ones that I provided, and that's not all of them, those were only the ones that comparably, I looked at the entire budget document that the county puts out, and I compared our agency to several other departments. And those were just the ones that really jumped out at me as to, gee, the health department is paying for all of them, but these other departments don't pay for those. And that was to the tune of $666,500 for this coming fiscal year that we're planning for.
So in other words, a lot of the other county operations are kind of tenants in buildings that are managed by the county.
Right.
They have space to run their programs, but here you're covering security, housekeeping, rents, garbage removal, on and on and on, to the tune of almost $700,000.
Exactly.
Any response from the county in regards to asking about the payment?
Not yet.
Okay.
I was at the county today doing bargaining,
Yeah.
and I was sitting next to Rashawn Howard, who is the budget director for the county, and I mentioned it to her. I said, I asked her what our drop dead date is to make any changes in our budget. She said September 1st. And I said, well, that's just a couple weeks away, but I haven't gotten any response from the county as to what they can do for us, or if they're going to do anything for us. And it makes it very difficult to, how are you supposed to submit a balanced budget with a huge gap like this and not knowing if you're going to be getting any aid, so that's where we're at.
Could I ask the word privatize?
Yes.
Well, privatize, or basically severing ties with the county and have it more like a more traditional FQHC.
Right.
That's what you mean by
There would be
privatize.
no co-applicant agreement. It would no longer be part of the health department. Right. And again, the services that are provided there are, none of this is personal, this is fiscal. We just have to look at it very objectively, and, this is a public health department, and I have to look at, as a public health department, what are we mandated to do, and what can we afford to do? So, and I don't want to just one day say, oh, gee, we got to close this division, and gee, lay everybody off. It's not the responsible way to do it. We need to plan, we need to, and I think we also need to provide, Joe and Mary and Dr. Bird an opportunity to, get some answers, be creative, look at their own divisions and come up with some different strategies.
And I would take it one step further than that, and I would say that every division, including administration and environmental health and family health services, everyone needs to look at every part of their operation and say, are we doing this as efficiently as we can? How can we bring in more money by what we're doing? How can we spend less money? I mean, we're an agency, we're all part of the same agency, and $1 earned in environmental health by raising fees is $1 less that maybe has to be eliminated somewhere. But you need to do that. I'm going to throw out a couple of examples, and Dr. Bird's going to probably throw something at me and hit me in the head. But Sue mentioned dental. I'll mention the van. What does it cost to operate the van? And I'm not even looking for an answer. We're going to be looking for answers from each one of you every month. This is coming back here, and I want to hear progress. We're not looking at doing this in the next 3 weeks or months. Maybe we've got a year window here that we can hopefully come up with some innovation Take a look at delivering babies. It's expensive to deliver babies. How much are we bringing in through the delivery of the babies versus providing prenatal, which, as I recall, is the minimum that we have to do? And let the babies go to the hospitals and let the board call deliver them. I mean, we're talking about worst case scenario. We don't have enough money to operate everything. Something is going to have to change. And you all have the opportunity to go in and be creative and say, we don't want to do this, this is not a good thing, but we could save $500,000 here. WIC, the WIC grant, what, $1.5 million? We spend $500,000 on top of that. Is that necessary? If they think we can run it on $500,000, can we? Or 1.5? Not looking for answers. I'm throwing out, you know, I'm being the bad guy here. I'm throwing out those things and I'm trying to tickle some nerves here. But we have to do that. And you all have the opportunity and the responsibility to look at everything you do and find a way to do it less expensively, find a way to do it bringing in more fees, and bring it back.
I was going to suggest that with your history, Jim and John, that you be on some special committee or maybe the board of 4 to meet with you and look at things and keep advice.
Well, I'm going to say no to that.
Okay.
Because they are the ones that know their program. When I took over environmental health, I looked at everything we did. And I said, why are we doing this? Well, we always did it that way. Not good an answer, not an answer I was accepting. We're not going to do it that way anymore. And put in fees. And I recognize that there's a lot of fees. But in environmental health, that's the only opportunity we have to raise fees where people have to pay them if they want to do business. Now, put a septic in, you're going to raise a fee. We need to take a look at what it costs to operate every environmental program, and what are we bringing in fees? And if there's a gap, we're going to raise those fees. If we got to double them, we're going to cover our costs, because $1 earned there is $1 that we don't have to eliminate somewhere else.
Yeah. I think you could look at all providers in the community that are offering similar services. Can we have some arrangements for referrals so that we don't have to do them here in this facility, but people can still get the service somewhere else in the community? It's just, it's dollars and cents. Everything we do here is of value, otherwise we wouldn't have been doing it for the last however many years. This boils down to strictly dollars and cents. And the expenses are outstripping the revenues, and have been for several years. You can only do so many innovative things, and we've been struggling with this for 5, 6, 7, 8 years, really ever since the economy kind of went bad in 2009 and 2010.
2008,
And we've been cutting and we've been reducing and we've been scaling back, but you can't do that on a small level anymore. It has to be larger in order to get to the numbers that you need to get to.
We've done the easy things to do. And those easy things, when I say easy, they weren't easy. It's never easy to eliminate 100 positions and all of the services that those folks provided to this community. You know, this is breaking everybody's heart to have to do that. But we had to do it to survive. You don't have enough money. You don't have enough money to do everything. And grants, you know, we've been down this road before. A grant gives you enough money to pay for part of it. They don't give you enough money to pay for everything. And then you've got, every year, health insurance goes up, IMRF goes up, raises, contracts, everything, cost of electricity, everything we deal with at home. And there just has to be a revenue source to cover that, or you need to go in and make reductions, which is why there's 100 less people working here than there was maybe when I retired. I don't know, maybe since John retired, I'm not sure. But you know, it's nothing pleasant, but it's a reality. And we all, you all, need to control your destiny here and really look at everything and say, you know, we don't need to run that van anymore, and we can save $50,000. And I'm just using that as an example. I'm pulling it out of hot air because I don't know the numbers. But you better find out the numbers, because you're going to come back with this board with some options. And those options need to be based on real numbers. What it costs, what we bring in, what are the savings, and how does it fit into the whole pot. And Judy, I appreciate your suggestion. Maybe you're being a little kinder to me. I'm not going to speak for John, that I could come in. I don't know what these people do. I don't know what they do. They know their programs better than anybody else in this room, better than Sue. That's where your answers are going to come from. That group, because they are the experts.
Yeah, I agree. You're going to kind of start from the ground up, and, you know, based on the people you serve and the numbers that you serve, what do you need? Well, what your manpower needs, what are your capital needs, and try and build to the level of the funding that we've got available.
My hope, and I've shared this with everybody that I met with, my hope is that we can hold on until we get in our new building, because I'm confident that that will provide us with some efficiencies with staffing and also just dollars. It should be cheaper to heat the place. It should be cheaper to cool the place. It should be, you know, cheaper lighting. I mean, really, I think we'll save some money in the new building. So I'd like to just see if we can hold it together till then. But to your point, Jim, I'd like to, if it's okay with you, have this as an ongoing agenda item.
Yeah.
Because I would task each division director to come back every month with progress. What they've looked at, what they've found out, what they've done. I think that I think the board needs to be actively involved in that.
I agree. It should be on the agenda.
It should be their job, but report this way.
Yeah, not that next month we're looking at, well, we're going to eliminate this or that. No, we're looking at some options now and some dollar value to those options. And some of them we may implement very quickly. If Tom comes up and says, geez, we can make some money raising the fees for food because we haven't done it for 3 years, and it brings in X number of dollars. And we could do that fairly quickly.
And he's looking at that right now.
I know he is. He's on top of it. That's terrific. And we have always done that, whether it was me or Mike or Elizabeth, we've always looked at those fees. But now we need to look at them not based on what they are and what the surrounding community is. It's what's it cost to run the program? And we want to collect, get back 100%. We want to cover that. Much like we did with the jail with Joe's program. What does it cost to run the program? And that's what we should be recovering. We shouldn't be putting any public health levy dollars into that. It should be 100% covered.
So a mechanism to allow Sue to basically generate a balanced budget in the next however many weeks. You know, one of the strategies may be to utilize cash reserves as kind of a plug number to fill in the gap, to get it balanced, to get it submitted. But then that doesn't mean that, you know, between now and December 1, if significant changes are made, then you'll never use those dollars because you won't need them in the budget. But something needs to happen to get this thing submitted. Is that what I'm hearing?
Absolutely, yes. September 1 is the deadline with Sean, obviously, the budget director of the county. She has to, she has to assemble everyone's budgets and then put it all together and balance it. And
now, if you get some news from the county on whether it's infrastructure costs, whether it's on one-time funding, additional money, you can put that in and then reduce your cash award, whatever combination to kind of get it in balance is a stopgap to buy time, because this will take time to develop what we're talking about.
Yeah, we're talking some short-term and long-term issues here. Well, I invite any other board members who'd like to make a comment, and we'll move along.
I think it's important for each division to figure out how would they go about addressing the concerns, because it affects their patients.
Yes, it does.
They know better than anybody else who's going to be affected the most.
Right.
So, and then bring something back, and that way everybody's satisfied.
And it should come back to the board as a whole.
Yeah.
So we're all up
For
to
discussion.
speed. It's a critical issue.
Exactly.
And I think we all need to hear that and see the progress and the options.
And it'll take time to do.
Yes, it will.
Exactly.
Yeah, I think we've got to go next budget year, and hopefully something will materialize to,
Of course, we start building the budget again in
uh,
May.
April, May.
Yeah.
maybe get a couple of months
Yeah,
rest there.
we'll get it.
Right, any other questions or comments? Comments from our directors, anything? Okay. All right, move on to new business, the disposal of a surplus vehicle, the 2003 Taurus.
It's got a flat tire right now, so.
Yeah, it is out in the parking lot. We did get our new van, obviously, several months ago. We did have the county garage review the vehicle, and they did come up with the recommendation that it gets surplus. There was issues with the brake lines, a rusted undercarriage. It is approximately 14 years old, and it has roughly 90,000 miles on it. So we asked to get something in writing from them, but they just verbally told us that that's acceptable.
I'll entertain a motion to approve that resolution.
Second.
Moved and seconded. Any further discussion? All in favor, signify by saying aye.
Aye.
All opposed, motion carries.
Thank you.
All right. Okay, the next thing we have are some amendments to the Community Health Center Governing Council bylaws. It's amazing to me, having written the original bylaws, how every time somebody comes out, they find new things that have to be in there and written in a different manner.
Yes.
I mean, I sent them to HRSA, I spent an hour on the phone with somebody, is this what you want? Yeah, that's good, that's all good. And now we're back to changing again, which I guess is part of life, right?
Well, it's the problem du jour. And maybe some health center in the, Topeka, Kansas had a problem with, this has to do with conflict of interest.
Right.
So they decided they better take a look at everybody's word.
Better beef it up. All right. Okay.
These have gone to the governing council and were approved by the governing council. So,
I'll entertain a motion to approve the bylaw revisions as submitted.
Second?
Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. All right. Dig through here. These bylaws didn't used to be this long as I remember.
Oh, and that's not even all of them. We just
That's
put
a
most of
section.
the pages in there that were changed, yeah.
All right. I may be thinking of cooperative agreement, maybe
Yeah, I
that's
think
short.
that-
That one's good. Okay, now we are, Resolution 1728, transfer of appropriation within the Community Health Center, moving some money from, what?
From full-time
Down
salaries.
to drugs and
Yes,
medicine?
and to one of the capital accounts. They had 21,000 in the capital account. And in order to make sure that we can pay for the drugs and medicines for the 340B program, which is going very well, we are generating a lot of revenue there, but we do need to replenish the meds. And then we also are looking to put some additional dollars in the 3120 medical services, not much, about 50,000. That happens every year. We kind of go one way or the other.
All right, I'll entertain a motion to approve Resolution 1728.
Moved.
Second.
Moved and second. Any further discussion, questions? All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. All right, Resolution 1729, transfer of appropriation in family health services. We get some money from
Yes,
full-time to contractual.
The requirements to be a breastfeeding peer counselor have changed within the program. So we can no longer do it as an employee basis. We have to do it as a contractor. So we had money in the budget, this current budget, in the employee line item. We want to hire well, we did hire the contractor, so we need to move it from the personnel to the non-personnel.
Okay, I'll entertain a motion to approve Resolution 1729.
Moved.
Second.
Moved second. Any further discussion? All those in favor, signify by saying aye.
Aye.
Opposed?
I
Motion
wanted to
carries.
say, isn't this a whole thing you could eliminate? There's a lot of volunteer breastfeeding counseling out there. Too late, we've gone.
Yeah.
Well, it's actually, this is a grant program, breastfeeding peer counselor, and what they want are current WIC moms who are breastfeeding now or have within the past 3 years. So they're trying, it's an entry level for a WIC client to get a vendor job, a contractual job, and to help peers, per peer is what we're doing. Yeah, we can't, for the WIC program, we can't utilize outside volunteers because these are WIC guidelines that we have to go by.
Okay.
Though the hospitals have different things, but the hospitals have different opportunities for volunteering.
We already voted tonight.
Yeah, we did.
And, well, this is for this year's budget. We can always look at things for next year's budget.
Right. Now, okay, annual management address, Sue, did you already cover that? or?
Yes, let me think. No, I didn't. Yeah, I did. Yes, I did.
We don't have a need for executive session.
No, we do not.
Personnel status report. Looks like you got a lengthy one this time.
Yes.
New hires, resignations. See the dental program manager resign?
Yes, we had a resignation from the dental program manager, the administrative assistant for Dr. Berg, I believe in the same week. We're very close to each other. Yeah. What did you say?
I said apparently the two of them had a meeting.
Oh, we've recently had a provider quit without any notice. So we're going through some changes there, but, yeah, well, this is of course 2 months. So,
That's true, yeah, that's 2
that's the other reason why it's a bit lengthy. We did fill the position for the billing supervisor in the health center, which is a great thing. So far, she's working out really well. A lot of great ideas that she's brought to Mary and I regarding the billing.
And my assistant got a very good job with the hospital association, making more money and good opportunity for she and her family, and she'd have a staff. So, I wished her well, certainly. The pediatrician opened her own practice.
All right, any other questions here? I'll entertain a motion to approve the personnel status report for July, August.
Moved.
Any further questions? All those in favor signify by saying aye.
Aye.
Opposed? Personal status report is approved. You're having an open house on Friday. You want to talk about that just for a minute?
Yes, it's from 10 until 12. We are having representative from, our representative Bill Foster's office, and we are having Senator Bertino Turan. We're having many of the programs from the health department are coming for screening and for educational presentations, refreshments. So we welcome everyone, please to join us.
For National Health Summit.
Yes.
Anybody else have anything they want to plug?
Captive audience here.
All right, board members, concerns and comments? And we're about a half an hour early here, so if somebody wants to talk for a half an hour.
So moved.
Everything's scheduled to be here, so. All right, there being none, I will entertain a motion to adjourn.
Second.
All in favor?
Aye.
Opposed? We're adjourned.
Should be.